Again, thank you everyone for joining our webinar on personalizing healthcare. Today we're going to talk about how omnichannel solutions can transform the experience your patients have with your healthcare providers. First, we'll introduce ourselves.
Hi, I'm Mike Mangi, a Director of Strategy at Phase 2. My focus at Phase 2 is on technical innovation. I have 17 years experience producing websites, and for many of those years I've worked with healthcare clients, helping them through digital transformation on both enterprise level and campaign level sites.
And my name is Riche Zamor. I lead the strategy and analysis team here at Phase 2. Our team helps clients effectively plan, execute upon, and measure the impact of investment in digital technology. I've spent about 11 years in the digital strategy space, initially doing digital marketing and social media consulting, and then transitioning to specialize more in implementation of enterprise CMS and CRM clients, CRM systems for clients in the healthcare, financial services, high-tech, and non-profit sectors. So I'll tell you a little bit about Phase 2 for those who are not familiar. We're a digital agency founded in 2001. We offer a range of services from digital strategy to user experience, design, and development. We have offices in New York, DC, Portland, Oregon, not Maine, and San Francisco. And we work with a number of healthcare clients such as Johnson & Johnson, Memorial Sloan Kettering, Columbia University Medical Center, and Northwell Health. So there are a number of new regulations and guidelines that are changing the healthcare landscape, but patient expectations have been changing as well. So we're going to talk a little bit about that and really touch upon some reasons why healthcare providers really need to respond to these changing expectations in order to stay relevant and competitive. So digital media consumption has been increasing rapidly. Traditional media on the reverse has actually been on the decline over the past 10 to 15 years. Between the period of 2010 and 2015, while traditional media had decreased, usage of the internet increased by about 105%. We're seeing that people are spending an increasing amount of time on both social media and mobile and other digital devices. Now, these digital experiences are increasingly offering consumers a personalized experience. And roughly 62% of consumers who are using mobile and web experiences are personalizing their experiences themselves. And that cuts across channels to include social media, websites, mobile applications, and the such. Now, consumers are becoming conditioned to want a personalized experience from the brands that they're interacting with and the applications that they're using on a day-to-day basis. And that desire for personalized experiences is really seeping into the healthcare space. So patients have high expectations of healthcare providers. And those expectations are really being driven by this improved experience that they're having with consumer brands. So roughly 83% of consumers expect that healthcare providers their needs. And despite that high expectation, there is a general low level of satisfaction with healthcare providers. Only 34% feel that healthcare providers truly understand what their needs are. So now I'm going to pass it to Mike Mangi, who's going to walk us through how U.S. healthcare providers can leverage omni-channel solutions to help meet these changing patient expectations.
Thank you, Riche. You've heard us mention omni-channel a few times, and it's also part of the title of this webinar. But for those of you who might be unfamiliar with what omni-channel is, I wanted to start by talking about how it is as a strategy and how it's different from multi-channel. You can imagine a multi-channel strategy as sort of a siloed strategy. You could tailor content based on desktop format for browsers, tablet, mobile, but each of those touch points or channels are not in any way connected. Omni-channel connects all of the channels together to provide a frictionless, kind of seamless experience across all channels. So you can imagine a user coming to a website and filling out an online profile, and later downloading an app, logging in with that profile that they've set up on the website, and having all of their data connected. Later on, they might call customer service, and customer service would be able to pull up all the profile data and understand the interactions that they've had both on the website and on the application. Everything is connected together versus kind of a siloed experience. So omnichannel is made up of a number of different components. Our focus today in this webinar is around content and how that can be personalized. You can imagine that when you start out coming to a site or an application, that's the touch point, right? How you come in. That might be from your mobile device, your tablet, a browser, the way that you first interact with a brand or site. There's some context that's set around that. You might have some geolocation data. You might know that the user has come in from a search engine query. That context, along with the touch point, filters into a set of conditions. And this is how a user is using your site or application. Are they selecting specific categories? Are they making choices? Are they in a logged in state? And together you can use all of this information, this data that you have around how a user is coming to you, the touch point they came in, the context around that, and the conditions that they're selecting within your site or application to provide really personalized, tailored content. After they've experienced the site, you have another mechanism for collecting data, and that's with a feedback loop. And that could be analytics, it could be a survey, it could be a form that they filled out. You can take this information and further tweak and optimize the experience for the user. So as I said, we're going to start with personalized content. Content is still king, and rather than thinking about your omni-channel strategy as, oh, we've got all these different channels, how do we connect them? Or, oh, we have to think about our technical infrastructure. Instead, start with your content and think about how you could go about personalizing it. Personalized content really increases the relevance for the user. In this case, we're talking about patients. It makes the discovery of information a lot more efficient rather than just an open text search or trying to cull down the wealth of information on the internet. It's tailored to a user's needs. The more tailored or personalized content is, the more patient or user starts to feel connected to the brand. And this connection builds trust. And that personalized content is a lot more trusted than other sources. So there's a lot of benefits to delivering personalized content. It increases patient satisfaction because they're getting the information that's directly tailored for their needs. It provides a higher degree of engagement. They're more likely to like or comment on content that's tailored to them, or just read or spend more time with content that's tailored for them. All of this increases conversion. They're more likely to sign up with a healthcare provider that's providing them personalized content. And with this great experience that they're having, they're more likely to increase retention and stay with the provider. And all of this together provides efficiencies in service delivery. The more that you can tailor content to your users, the less time that they may spend calling support or looking for additional help. So how can you go about gathering data to personalize content? Well, there's a couple different types of data. There's implicit data tracking how a user is acting within a site or application, and explicit data, data that a user is providing to you. We've broken out three different categories of data collection here: behavioral, demographic, and interest. Behavioral might be coming to a site and clicking around, watching a video, liking or commenting on content. And you can use that information about how a user is interacting with your site to further tailor content. That might be through related articles or other directed feedback based on category selections. Demographic-based information could be geolocation information, how a user is coming to you, language selection. In the explicit side of data collection here, it might be profile data that a user has filled out. If they've provided information to you, they kind of expect that non-relevant information is filtered out for them based on the profile they've set up. And interest-based might be search keywords. If they've taken an extra step to sign up for an email newsletter around a certain topic, say eating healthy, and you could then send them tailored daily recipes. And you should use all of these types of data collection together to form a holistic, tailored experience for the user. Okay, privacy and security. So we know what you might be thinking, that in the healthcare space, there's HIPAA requirements and requirements around personal health information and personally identifiable information that kind of prohibit this type of personalized content. And of course, you can set up, VPNs and firewalls and encrypted data and single sign-on and those kinds of things. That's not really in the scope of this webinar. Phase 2 has a lot of experience setting up secure systems and can certainly help you with that. But as far as personalized content, really what we want to talk about here is transparency, and that implicit data tracking what people are doing versus explicit data, data that users are providing, and being very transparent with what you're collecting, how you're using it, and making sure that everyone is opting into it. Subtly presenting data based on information that your users have provided will make them feel a lot more comfortable, especially if it's showing value. You're tailoring the content to them and therefore decreasing the amount of work that they have to do. So I want to take you through a case study of a pet health and wellness system that Phase 2 recently developed. I realize this isn't a human system, but I think as I walk you through the case study, you'll be able to see pretty easily how this could correlate to human patients. So the first screen you're seeing here is a dashboard view. This is for a dog owner. They have set up a profile with the site and have entered information about their dog. You can see some data charts here to the right that's connected to a device that's much like a Fitbit or Apple Watch. And you can see across the bottom several categories of personalized content that they've selected for more information about. You can imagine how this would easily translate to a human, where you could track that Fitbit data and have categories of personalized content. So the pet owner starts out by filling out a pretty detailed profile. They give their pet's name, the breed, weight, body condition, energy levels, health concerns, some nutritional information, maybe about their diet. And all of this information they're providing really helps to tailor and personalize the content that they're receiving. So there's a great benefit for the dog owner to do it in this case. You can imagine for a human, having this kind of baseline profile data set up would help to help to organize the content you're getting, but is also a place that has data that you can collect with from your doctor and share back to your doctor. In our system, we could set goals for the pet that might be to help maintain their weight, increase their activity levels. It might be a goal set by the vet based on their last visit. These goals, again, help to tailor content that helps them achieve the goals. And of course, you can imagine, coming in as a human and setting health goals. Next, we see a data display for data collected by the sort of Fitbit, Apple Watch device that the pet owners used with their pets. It's collecting, their activity levels, the time of day, heart monitor. And this is very similar to what you might see on a human device. And we feel very strongly that data in this type of display is a strong type of personalized content. It might be that you have health data trapped in 3 different apps, or it's difficult to see in a dashboard view connected to other health goals or other health information. And providing this kind of ability to slice and dice and see at a high level is a great way to additionally personalize content. So all of these things work together, that the personalized data charts, the profile, the category selections, to fill out a personalized content library for the pet owner in this case. If they need some help achieving goals, they'll get content around maintaining that healthy weight, maybe diet, activity levels, etc. And to make it a little bit easier on the pet owners, we set up a weekly snapshot summary with both the data collected from the device, but also the top articles related to their profile and goals. And this just makes it a little easier. It's passive. They don't have to remember to log into the app or the website to check status. And again, these types of reminders make it easier for humans who spend a lot of time on their phones and may be distracted and would like reminders sent to them. So that was a pet health system. We're working with a number of healthcare systems here at Phase 2 on their digital strategies, and have been thinking a lot about what an idealized omni-channel experience might be like. So I'm going to walk you through our thoughts around what a future healthcare experience could be. And I'm going to do this in the form of a story about Linda. Linda is pregnant for the first time and, of course, wants the best healthcare system to guide her through her pregnancy. She starts, as most of us would, by going to her search engine and searching for hospitals nearby. She starts to look at their ratings and reviews and considers that. As she hones in on a specific hospital, she sees that they have a virtual tour. They've got some great testimonials. It's really easy to schedule an appointment through their site. And from the site's end, they see that we've got this new person who's interested and very engaged with the site. So she likes what she sees, and she downloads the hospital's app and sets up a profile on it. She's now able to easily schedule her appointment and connect to the site. She can set up notifications and reminders and connect to her other devices like her Apple Watch and her Amazon Echo. And because she's taken the time to connect her devices and set up a profile, her communication with the hospital is seamlessly woven into her life and preferences. She gets those appointment reminders right on her phone. She can ask Alexa when her next appointment is. When she goes in for an ultrasound, the images are shared with her through her account, and she can share those out on social media if she chooses. And Linda gets this personalized information easily throughout her pregnancy because of the way that she's connected things. Perhaps one night she wakes up not feeling well and is very concerned. She could have a conversation with a doctor online through a chat. If the doctor felt that they needed to talk in person, they could set up a video chat and help her decide whether she might need to come in. So when it's finally time to deliver the baby, her in-hospital experience is as seamless as her in-app experience was. When she gets to the hospital, the in-app map helps her navigate to the maternity center. When her baby's born, she gets a congratulatory email for her with her name and her baby's name. And she's able to easily schedule her follow-up appointments. Because Linda's had such a fantastic experience throughout her pregnancy, she is able to share her positive feedback on social media and recommend this hospital to other expecting mothers. So now I'm going to pass to Riche, who's going to walk us through some ways to get started.
So let's step back for a minute. We've covered some great concepts as they relate to omni-channel and personalization, walked through what a personalized might look like for you as healthcare providers as you look to leverage these approaches to improve the patient experience. But omni-channel is very daunting, right? When you hear about new platforms like Amazon, like Apple Watches and Amazon Echoes, it seems like you may have to do a lot in order to start leveraging omni-channel approaches or personalization to really improve the patient experience. So we want to talk through some initial steps that you can incorporate into your existing digital strategy to actually help your organization leverage personalization to start creating a better patient experience in the short term. So the first step is developing personas, just to better understand your audience. You may have personas already. For those who are not familiar with personas, they're fictional caricatures of a particular group of customers or patients that you interact with. So I recommend starting with personas because they give you a very clear understanding of who your users are, so that you can start to fully understand how to improve the patients for those. Improve the experience for those patients. Now, when you put together a persona, aside from creating a fictional character to represent some subset of your users, you want to also define what are the goals that individual wants to achieve by interacting with your healthcare provider. What are their needs? What do they need from you as an organization? What do they need from outside of your organization to accomplish those goals? What is their level of technical proficiency, so you have an understanding of what are the technologies and systems that they might use to interact with your organization, and what might be the technical limitations that are put in place? What motivates them to achieve these goals, right? Like, what would make them happy if they were to achieve these goals? And what are the things that frustrate them in accomplishing these goals? What might prevent them from actually trying to accomplish these goals in interacting with your healthcare provider? Now, once you have a solid set of personas representing the different types of users or patients that you would be interacting with, then develop user journey maps. Now, these visualizations really help you to understand how your patients are interacting with your organization at a fairly granular level. So you want to define, again, like, take the goals you have defined in your personas, once you have a good understanding of what your patients are trying to accomplish, and didn't really map out what are the different steps that they take to accomplish those goals, and what are the touch points that they're using to interact with your brand. And those touch points might be your website, your call center, mobile application, and social media. What are all of the different channels and avenues in which they can actually interact with your brand to accomplish the various tasks involved in achieving a goal? Now, along the way, your users are thinking and feeling different things throughout this process. You want to really get to understand what are they feeling throughout this process and what are they thinking, because that's going to really help you to identify what works about the current process that they're using to interact with your brand to achieve that goal, and what's not working, and how can you improve that interaction at that particular touch point to create a better patient experience. Now that you have your journeys put together, you have a very good understanding of how do your patients actually go through this journey to accomplish their goals. What are the areas in which you can improve that experience to really build better relationships with your patients? Then you can start to look at how do you incorporate those tactics and techniques and into your digital strategy. Now, this can be challenging. There's no, one framework that is best for using this. We do have our own methodologies here at Phase 2 that we use for helping our clients to plan through how they incorporate different technologies and tactics into their digital strategy to improve the patient experience. Throughout that process, you really want to start to identify what are the opportunities that exist. You want to do a evaluation of those opportunities, looking at the benefits and the risk of actually adopting any of the tactics that you identified through your journey mapping process. And once you've chosen the right tactics and initiatives to use, you want to really roadmap that out and plan for how are you going to execute upon that strategy over some set period of time. Now, the next step is really all about execution. Now, this is a part that can seem the most daunting because it seems like you may need to redevelop your website or purchase a lot of new technology in order to leverage personalization and omni-channel to improve your patient experience. But we really recommend that organizations start small. Identify a digital property or a feature of a digital property where you see a great opportunity to incorporate personalization because it's going to add value for your patients. And then develop some hypotheses, like what are the outcomes that you think that you can achieve by incorporating personalization into that particular element of a digital property or a digital property. And then design experiments that are going to help you actually test out those hypotheses to validate whether your assumptions that you're making in developing your hypothesis are correct or not. Then once you've actually validated or invalidated that assumption, take whatever it is you've learned and use that those learnings to improve upon your digital properties over time. Now, measurement is critical for leveraging personalization to improve your patient experience because systems that you're leveraging for personalization learn from the interactions that you're having with your users over time, and that data that you're pulling back from those interactions help you understand whether your personalization strategy is effective or not. So there are two techniques that you can use which, when put together, really give you a solid understanding of whether your personalization strategy and your omni-channel approach to engaging your patients is really working. This top-down approach is really about cross-channel measurement and assessing the influence you're having on the perception of your healthcare organization with your patients. Now, this influence oftentimes is implied using inferential feedback. So we're looking at brand metrics such as consumer opinion, recall, metrics like that, and really trying to assess what are the opinions that your patients are formulating about your healthcare provider through the interactions that you're having with them. Now, when you tie that together with a more bottom-up approach, where you're also doing cross-channel measurement, but you're gathering data from the interactions that you're having with your patients, and that's coming from clicks that they make on online ads, forms that they're using to sign up for your email list or to schedule an appointment, comments that they might make in your blog, taking all of that information and aggregating it to understand at a fairly granular level how you're interacting with various types of patients and what their response is to the marketing efforts that you're putting forward. So these two approaches, when combined, really give you a strong understanding of the impact that you're having with your personalization strategy on your patients and improving that experience. We do have a blog post about this that's written up on our blog. We're happy to share a link with that for anybody who would like that information. So we're going to stop here and allow for questions. If there's anybody who needs to drop early for any reason, if you would like to ask any follow-up questions, or if you'd like to request a copy of the presentation, you can email us at health@phase2technology.com, and we'd be happy to send the deck to you or answer any questions that you may have. And for those that can remain, we'll turn this over to you and take any questions from the audience.
Okay, I'm seeing a couple questions come in through the questions tab here. The first one is, I heard Alexa mentioned a few times throughout the webinar. Are you seeing real viable trends in healthcare companies investing in that kind of technology? And how does content strategy play into that? So I think at this time, some of these technologies are still pretty nascent. They're just starting to pick up steam in the marketplace. And I think before really honing in on any one type of device, it's again important to think about your users, their journey, and what they are most likely to use, and what might be easiest for them, what already fits into what you have. It may be that you have a lot of users that are really into voice systems like Alexa or Google's Home. And in that case, it might make a lot of sense to make an Alexa skill that makes it easy for them. But I don't think you have to worry about starting there. Really, again, start with the content and your users. Riche, I don't know if you have anything to add to that.
Yeah, just to add, I completely agree with everything Mike said. Just to add, sometimes there is value in experimenting early with these systems, not necessarily developing an application that you're deploying and expecting some major return from, but just as an organization being ahead of the curve and starting to experiment with a lot of emerging technologies and channels and platforms, because once those platforms or technologies become hot and they're the next wave through which you should be engaging your consumers or your patients, by the time it's become a trend, if you're hopping on the bandwagon, you're already behind the curve. You've already lost an opportunity to maintain a competitive advantage. So this is an area that Mike Mangi actually leads up within our strategy practice, but really looking at how can you experiment with some of these new technologies and just learn from some of the applications that you can build and just have kind of sitting in a repository somewhere that you can use as a proof of concept for how you can engage with your users in the future.
Well, another question. Hi, any tie-in to EHR, electronic health records? For example, my chart, Epic. Yeah, I think electronic health records are another part of the holistic omni-channel experience, and any way that you can tie that into one system or one account for a user makes their life easier and helps to personalize content if they've agreed to allow their record to be used in that way. If the user has to go to a couple different systems to log in that are not connected, it isn't really an omni-channel experience. Shay, any thoughts there?
No, nothing I'd like to add to that.
Okay, hold on. How do you balance capturing marketing information, demographics, location, other user profile data, etc., with protecting patient information, HIPAA regulations, and where do you draw the line? So I think, there's, again, the implicit data that you might have around geolocation, how users come to you based on their location, the device that they may be coming to you on, and using some of that to tailor their experience, providing them a mobile optimized experience, providing them with locations of health systems or hospitals closest to them, things that are kind of anonymous and not connected to user profile data. The next level might be a user who does set up an account and is in a logged in state, and they have opted in to sharing a little bit more information. Where you kind of get in trouble with personal health information, PII, using any of that information without explicit consent for a user, or using it outside of a logged in state in some kind of aggregate form that's not intended for a specific user.
Yeah, to Mike's point, I think there's a lot you can do with inferential feedback that you're gathering. A lot of large companies are using machine learning to understand or to make assumptions about what a person might be interested in based off of the behavior that they have on your website. So you don't necessarily always need to use that PII in order to inform your personalization strategy. A lot of times you can look at information about the user that is just given to you from their browser or their interactions with your digital properties that help you to actually tailor the personalized experience to that individual.
Okay, there's a few more here. Can you give us some examples of healthcare systems that are doing omni-channel well and why? So I think, omni-channel is pretty new in the healthcare space. We're seeing it a lot in other consumer areas. Brands like Macy's and Starbucks, et cetera, will have connected systems that know which store you're in and might be able to direct you to content within the store, connect to rewards programs, et cetera. Healthcare systems are really just getting started, but we see a ton of potential here. Frishay, you have any thoughts?
Yeah, I will echo your comment there. We're seeing a lot more of this happening in the consumer goods space. Healthcare-related consumer goods company we work with, Weight Watchers, has been expressing interest in doing more with omni-channel, and we're seeing a couple of our healthcare clients experimenting, but really starting at the point of leveraging personalization. I mean, healthcare organizations I'm familiar with that are doing this, just from my personal experience, Kaiser Permanente is one that I thought does a good job. They have, I think, a really great patient portal. Um, but again, a lot of this is really about the long road. It's really about starting now, leveraging personalization and some of the technologies that are available to really enhance the digital experience for the long term.
And I think that was a great segue into what I see as another question here. Can the healthcare space look to consumer sports and other industries for omni-channel advice and usage? And I think absolutely. Following the trend and sort of the way that we started this webinar, talking about how users, patients in this case, are getting used to these types of interactions in other parts of their lives with the consumer brands they interact with, sports, et cetera. And those expectations are being carried over into really the rest of their life, right? So they're expecting to have omni-channel type experience with healthcare systems. Okay, in terms of your technical approach, are you platform agnostic, more focused on Drupal? This person says they're a Drupal shop. I think Phase 2 does have a lot of Drupal experience, and especially open source technologies. But in regards to omnichannel, I think you do have to be platform agnostic to really be able to think about it in a holistic sense. There's going to be systems, platforms, devices, channels that you need to connect to that are probably not all the same. So part of an omni-channel approach is being able to set up APIs or other ways to connect many disparate systems together.
And just to note, I mean, like what platform you use is really dependent on what the requirements you have as an organization, but we have actually seen a lot of potential in leveraging Drupal 8, which is the latest version of the CMS, which has come out to build these type of experiences. We've, I'd say, almost 3 years ago now, worked with Memorial Sloan Kettering to develop their website on Drupal 8. It was one of the first enterprise websites to be launched on that platform, and it does incorporate some personalized experiences. And we just saw that the technology that was available in the latest version of Drupal was great for that. So there are some benefits to leveraging Drupal and open source technology that give you some more flexibility in constructing an architecture that's most beneficial for your organization.
Okay, one more. Can you talk more? I mentioned APIs, so can you talk more about the API-driven approach you guys take? So I think APIs, which is application program interface for those who may not be familiar with them, and it's just a way of connecting different systems together through a sort of common or connected technical vocabulary. So yeah, I think the approach here is looking at all the different systems that you want to connect, figuring out how to develop an API that would best connect them, and using that. One of the critical points here is things like single sign-on, so that a user can connect to different systems with one login, having an analytics system that tracks across different touch points and applications also is another way to use APIs. If you have something like an electronic health record that's stored in a very secure system, and a patient is in a logged in state and needs to pull that up for their doctor, an API would allow that type of connection.
Yeah, and one trend we're seeing with our clients both in healthcare and outside of healthcare is this desire to adopt a content hub approach to their content management solutions. So building out a central repository that stores all of their content, which would be served out to all of their digital properties, whether that be their website, their mobile application, any type of digital experience that they're trying to build. And that centralized hub would basically be a push mechanism for these organizations to be able to have all of their administrators log into one system, create content, manage content, and then just program the logic for where it should be published and when. We are working with a healthcare system right now on developing that type of content hub model, and we've worked with some other media companies and consumer goods brands to develop similar platforms. So that is one trend that we're seeing kind of API related, is that desire to have a centralized content management system that acts as more of a hub rather than having a lot of disparate individual instances of a CMS that power different digital properties. It's really trying to centralize that for efficiency's sake.
That's all the questions I see. We do have a couple more minutes if anyone else wants to ask another question. But I think, as Riche mentioned, we'll be making the deck available. Just email health@phase2technology.com. We're always happy to answer any other questions, and you can use that same email address to ask those questions as well. All right. If there's no further questions at this time, I guess we will stop the webinar, but please feel free to reach out. Thank you all for joining.